Hey everyone, this is Christy Bishop and thank you for joining us today. As we do every week, we are going to talk about the world of healthcare. And in the world of COVID, I'm sure you all have recognized there are a ton of acronyms. The CDC, the FDA, the HHS. So let's explore these agencies and what are the differences between them all. And with technology that most of us have experienced, my teleprompter is broken, so I'm literally going to read from paper. My apologies. So the first agency we're going to talk about today is called CMS. It's the Center of Medicaid and Medicare Services, and it's part of the Human and Health Services Agency. At the core of what the CMS does is they support patients by implementing innovative programs and technologies to support the triple aim. What is the triple aim, you ask? Well, it's quality, access, and affordability. The CMS is accountable to add value to the U.S. government by analyzing data to prevent fraud and abuse of the insurance system. They're also accountable to over 100 million people in the United States that receive health coverage through Medicare and Medicaid and the Health Insurance Exchange. These services cannot possibly be implemented by the private sector, as only the government can control the dollars that we spend on these insurances. Okay, next up. The National Institute of Health, also known as NIH. The NIH is an organization committed to research that will improve and predict health. Their budget is $41.7 billion that they use for medical research. NIH is the largest public funder of biomedical research in the world. Their mission is to allow people to live longer and healthier lives by making diseases less deadly and create intervention to prevent illness. An example of the value that they add, is the Framingham Heart Study that identified the drivers to heart disease. While there are many research organizations in the world in the private sector, for example, the Susan Komen Foundation, there is none as well funded as the NIH. Additionally, the accountability for the health of patients in the world makes NIH powerful. All right, let's talk about the big dog now, HHS. And this is the Department of Health and Human Resources. It's mostly comprised of political appointees rather than career staff. The value that they add is the oversight of many agencies, including the CDC, Dr. Fauci, FDA, and CMS. These programs have accountability for ensuring health safety for all Americans, particularly those who cannot help themselves. Because of all of these things and the funding from the government, it cannot be replicated in the private sector. Let's talk about the CDC, the Centers of Disease Control and Prevention. The mission of the CDC is to protect Americans from health threats, both foreign and domestic. The value that they add is using the highest quality scientific data to make vital public health decisions, such as when should schools close because of COVID? When can we stop wearing masks? When can we social distance? The organization is accountable to all Americans looking for guidance on infectious disease, such as COVID-19. The private sector would never have the regulatory power and therefore would not be a viable option to replace the CDC. The FDA, the Food and Drug Administration. The FDA is part of the HHS. Again, the Human and Health Services. They regulate food, including infant formula, dietary supplements, bottled water. Additionally, they regulate prescription and over-the-counter drugs. However, they even do more than that. They regulate medical devices, microwaves, cosmetics, and tobacco. They're accountable to the American public to keep our food and medications safe. I don't believe a private sector organization would have the same credibility as the FDA does to make these decisions. The final one is, what about your state's medical board? So I live in Colorado, and in Colorado, the medical board was instated to regulate the licenses of medical doctors, doctors of osteopathy, physician assistants, and anesthesiology assistants. The value that they add is for Colorado residents to feel safe that their physicians have passed the board and are legally able to deliver care and services. This board is accountable to all licensed providers as well as the Colorado public. While there are private sectors that help credentials for job applicants, this agency has to remember public. So I'll talk to you next week. I hope you got something out of this. If you want to talk to me, my email is christybishop22@gmail.com. Have a good night.